I'll lead us in the pledge. I pledge
allegiance to the flag of the United States of America and to the republic which stands, one nation under God, indivisible, with liberty and justice for all.
Thank you for that. Let's do a roll call. Teresa?
Commissioner Matthew,
Here.
Commissioner Hoffmeister,
Here.
Commissioner House, Commissioner Leininger,
Here.
Commissioner Baker.
Yep.
Commissioner Lenius.
Here.
Thank you.
All right, moving on to approval of the agenda.
With the addition of underneath new business, letter D, the discussion on July Board of Health meeting date.
Okay, I have a motion to approve the agenda as presented with the addition of the July added to new business D.
Or
We have motion and support and discussion. All in favor with an eye?
Aye.
Opposed the same. Motion carries. Approval of the minutes.
Move to approve the minutes from our May 23rd meeting as presented.
support.
Okay. Motion and support. Any discussion? Seeing none. All in favor with an eye?
Aye.
Opposed the same. Very good. Moving on to public comments. We do have public comments, and just for the record, for the purpose of public participation during public hearings or during the public comment portion of the meeting, every speaker prior to beginning the meeting is requested but not required to provide the board with his or her name, address, and subject to discuss. Speakers are requested to provide comments that are civil and respectful. Each speaker will be allowed 3 minutes for their comment. Do we have any public comment? You're up, my friend.
I'm not sure whether I should do this before or after all the report. I am here as a member of the local Masonic bodies. I belong to all three of the Masonic bodies, both Higher Lodge, Order of the Eastern Star, and the Shriners. We had members of the lodge come in back in April, I believe it was, and ask about food licenses for our kitchen and what we needed if we were going to do dinners or anything out of our building. At that time, we were told that the best thing for us was a temporary food license, which cost $65, is what we were told it would cost. So we decided that's how we would go rather than get a license for the kitchen and everything. When I came in to get a temporary food license for the Branch County Shriners to do a chicken grill during the Strawberry Fest, I was told it was $124 because we were not a 501c3. I questioned that as to why just a 501c3. Upon getting the license, I see that it's for commercial. It's a commercial license. I have gone back. All of the Masonic organizations in our building and in the state actually are 501c10s, and that is the IRS's designation for fraternal organization, domestic fraternal organizations. So we can't change, to be a 501c3. There's, a list of organizations or, entities that can be 501c3s. All 501c corporations are tax exempt. And in fact, in looking at information I got from off the IRS's website, even some 501c3s are not considered nonprofit. So I have sent an email in requesting to file a grievance, I guess, for the way we were charged. I was told that I had to bring it before the board, and then I was also told that it comes down from the state as to how this is
Worked out.
you know.
What was your name again? I'm sorry.
I'm sorry, I'm supposed to do that at the beginning.
That's all right. We forgive you.
My name is David Huntley.
David Huntley. Okay, David, let's do this. Will you shoot me an email offline? So your 3 minutes are up and we appreciate you coming for us. Shoot us an email and we'll see. I mean, we want to work with local organizations.
Okay.
So, you know, you shoot me an email and we'll see if we can.
Yeah, I sent one to John, Joe, and Paul.
Okay.
And Paul. You're
Yeah,
Paul?
this is Paul.
Yep, I see it now.
Well, we
Um,
appreciate the comments, David, and we'll try to get to the bottom and see if we can't work something out, but we appreciate
Yeah,
it.
because we're gonna come back again in September and do Apple Fest.
Okay, cool. Very good. Well, thank you. We appreciate your time.
Thank you.
Just a really quick reply. Our fee schedule is very specific, that in order to qualify for a nonprofit license, it has to be the 501(c). And that's, so we're kind of bound to that, but we'll get back to you.
Okay, like I
It,
said,
it comes from the state, that's their designation. And so we kind of follow what the state put out there, and that's,
well, and that's for probably a majority of your people that come in, they are 501(c)(3). But again, as a fraternal domestic fraternal organization, we are a nonprofit. We're just not a 501(c)(3). We're a 501(c)(10).
we'll get back with you. Yeah, thank you. Appreciate you coming in.
Thank you.
Because I certainly just real quick before we move on, I certainly see the intent. You know, you are trying to do something for the community. We should, and if it's a state that's mandating this, that hopefully we have some leeway where we can make some exceptions. I mean, we don't want to rewrite the entire playbook, but
Yeah,
You know,
we'd
they're
have-
doing
we'd have
something
to
for the
change their
community.
fee schedule because it's very specific on our fee schedule.
yeah, it's something we can look at. Yep, we appreciate you bringing it to our attention.
Okay.
Thank you,
Thank you.
sir. We appreciate it. All right, moving on to number 3, health officer's report.
Good morning.
Good morning.
So the first item that I talk about is really the majority of the meeting today, which is budget. So 3 items that are budget related. First being the AAA 3C budget amendment. Then we have our current fiscal year budget amendment, and finally an original budget for FY25. So those are all items that we will be talking about as we get further into the agenda. The one thing I did want to point out, and I'm sure we'll talk about it as we get closer, the budget amendment does include the fund balance now, which increases the total budget from 9.5 to 13 million. We were advised that the fund balance needed to be included in the budget. And so we have made that correction and now it is there. That there's no increase here. It's just how we're showing this during the budget, okay? All right, for MERS, we did receive the actuarial report and it is included today right after my report. You'll see that the MERS actuarial starts. And we have Marnie Daggett coming in, Marnie from MERS, who is our representative. She'll be coming to the August meeting. She's already scheduled to come in. So we will have her here to answer any questions that all of you might have regarding our closed defined benefit plan. We did want to let you know that we recently received a complaint from a recently terminated employee filed with the National Labor Relations Board. And we've been advised by our attorney that as a public entity, Branch Hillsdale St. Joe Community Health Agency does not fall within the jurisdiction of the NLRB, as public sector employees were not included within the definition of employer in the National Labor Relations Act. We're seeking a summary dismissal of the charge based on a lack of jurisdiction. The CDC infrastructure grant, we have wrapped up the projects that we had planned for this year. So those included the drinking water fill stations in all the buildings, with the exception of Sturgis. We did carpet and repainted the Hillsdale building. And the overall estimated cost that we had put in the budget was more than what we needed to spend. So we are looking forward to next year and starting to plan out projects for this next fiscal year. We might bring you a late in the fiscal year proposal because money still remains in what we had set aside for this year for another project. Just depends on if we can get bids and get that all ready for you. We did have kind of, I don't know if I'd call it an open house, but an opportunity for commissioners or board members to walk through the Hillsdale building this week. And if anybody would still like to do that, we can certainly make that happen. So Commissioner Leininger's, so it's nice to see him. Our staffing update for today, personal health and disease prevention. I think we have our part-time nurse full. Yep, and we are seeking to fill a clinic clerk position in Three Rivers and a part-time clerk that would be assigned to our mobile unit. The breastfeeding peer position is still open in St. Joey, unless that's changed in a week. It starts Monday. Oh, she starts Monday too. Well, there we go. We do have great news regarding our accountant. That person does start on Monday as well. So we have managed to locate an individual that we are starting. So Teresa is exceptionally excited about that.
I'm sure she is.
Very much.
Laura is seeking a part-time outreach worker and social work care consultant. So those are our current openings, although we do have a new opening in environmental health. Our environmental health supervisor that we recently added is moving on to take a position with the state of Michigan. Our intergovernmental agreement, so there was a little bit of a hiccup with regards to just the wording of the resolution in Hillsdale County. Luckily, when I sent up the agenda for that meeting, and the agenda used, the word approve in it, that they looked at that and they said, oh, yeah, this now apparently is clear to them. I don't know why it wasn't clear initially, but
Leave it to Hillsdale County.
It was
I can only guess which one it was.
It was the same language that was used the last time the intergovernmental agreement was approved.
this time again, flagged.
Something about you guys over there.
Under the water.
Well, the good news
You
is,
got that.
I was told that they are working on putting together the approval letter at this point. So I don't know how long that's gonna take, but, we've made it past, I guess, the call first. Kindergarten oral health, will be interested to see, what was decided with the budget that, I understand passed out of the legislature yesterday. So,
Early this
okay, early this
morning.
morning. Oh my goodness, were they there at 1 a.m?
Oh, I'm sure they were.
Yeah.
Free.
All right, so I don't know where we're standing with that, but, hopefully I will have more information for you in August. This is a program that the legislature instituted, and we were hoping that they would provide additional funding to make it so that we would be more comfortable adding it. So. The community health needs assessment at Beacon Health, we did sponsor a focus group meeting in our Three Rivers office last week on the 20th at 10 o'clock. It was well attended. Right around 20 individuals attended that focus group. Beacon was very pleased, and they are continuing to move forward with their process. Chris attended a meeting this week with representatives that are working with Beacon on that, and so everything's moving along. Public health concerns are measles. We haven't had any additional measles cases, which is a blessing. We do continue to work our measles response plan, which includes knowing your vaccine status and taking action to get the MMR immunization if you haven't received it or aren't fully vaccinated. Regarding HPAI, as you know, there's been a lot of impact to the state with poultry flocks and now also dairy herds. And there are some special orders that the state has instituted with regards to how farms should institute biosecurity measures. There will also be some special requirements at the fairs this year that relate to HPAI to try to limit further spread.
And as of right now, with the last poultry case, there can be poultry exhibits at fairs, but as of right now, there's still no lactating dairy animal exhibition allowed.
Milking.
Well,
They had to be tested.
can't even take lactating dairy animal to a fair right now.
I think as of late yesterday, you can, they have to be tested first.
They
It
did,
came out late yesterday.
they did modify the order.
All right,
Yeah.
because I was looking at the last date, and the last date for a positive herd was here in June, so I mean,
There
I
goes
kind of touched base on it in my report.
We just got an update from MDARD regarding that order, and there were some modifications made to it, so we will share that with you, after the meeting, or maybe I'll share it during the meeting with somebody else's stuff. Rabies wanted to share that there have been 4 additional positive rabbit animals identified since the, our last meeting. And so I provided the map again. The additional animals came from Kent, 2 in Allegan, and 1 in Jackson County. So I think Dr. Lucarello maybe is talking a little bit about this today or not. No, not today. But rabies is a concern. And, I think what I'm thinking of is you're working with Heidi's group, to make sure that we are prepared and ready should we have an animal that tests positive. The staff routinely work with families who notify us that they've awoken in the middle of the night to a bat flying around in a bedroom, for example, and then we provide guidance to those families. Usually, if they can capture it, we send it up for testing, and sometimes there's some prophylaxis needed. Tick season, I did provide additional tick information today. I believe that is also after the actuarial. If you want to submit, or if a resident wants to submit a picture of a tick for identification, the information is provided here on how to do that. So they just do it electronically, using a smartphone or a computer. And we are still waiting for final documents from MDHHS that can be released to the public regarding our investigation of Quincy school students. I reported on the annual report to the Hillsdale County Commissioners this week, and we'll be doing the same in St. Joseph County on July 16th. Branch County is putting it on file, and they're not requesting presentation. Coldwater, this is the paint color that was chosen, and they are making good progress in this building, getting the building painted. We still are working on selection of a contractor for upgrading counters in the restrooms. So if you go in there today, you'll see that those still need to be done. And also we've got some counter surfaces in our clinic area that need to be replaced. I think I mentioned last month that Schindler Elevator Company has informed us that we don't have the kind of elevator that needs the modification. So they have returned the deposit that we sent for that work.
No,
Yeah,
save some money.
yeah, because that is really expensive.
Yeah, surprisingly. But
So in Three Rivers, and I sent you an email about this, we had a battery incident using the rechargeable batteries used by our vector-borne program. We did conduct an investigation, or our EPC did on that. We have met to talk about institutional controls and are continuing some conversations about what institutional or environmental controls we can put in place to make sure that there isn't any exposure to an overheating battery in any of our offices in the future. The fire department was called in that situation. They removed the batteries from the building. declared the building all clear, once they had removed them and indicated that staff could re-enter. We were able to dispose of the batteries at the local Napa store. We do not have Board of Health Education scheduled until September. So in September, we'll have a topic for education. I would love your ideas on what you'd like to hear from us. If you don't have any ideas, we will figure it out. We'll surprise you. Surprise. Yeah. Thank you.
Very good. Thank you for that. Any questions for our health director?
Mr. Chairman,
Yes,
I
sir.
have two questions. The health officer, Ms. Burns, with your permission, I want to thank Mr. David Hundley for his volunteer services to our county and elsewhere. And the first question is, Mr. Chairman,
Yes, sir.
the health officer mentioned that fiscal year 2023-24 budget amendment number 2 is the finance committee had an opportunity to review this.
The Finance Committee did review, the original submission that we put together. Now, what's at your place, the yellow copy, there was a recognition that we had omitted measles funding that came to the health department in the amount of $25,000. So that has now been added, and when we get to that, the orange tab shows you where that, oh, it's not sticking, shows you where that was added to the budget. And then we have a couple of other marks in here that are pink and green that relate to what?
Yeah, I'll go over them when we get there, but just,
Yeah.
the pink and the green tabs just talk about the overall budget and what's allocated versus the fund balance, because the fund balance is now included. So it makes it a little bit more difficult to just look at how much money are we spending.
We can go over that. Yeah.
Mr. Chairman,
Yes,
thank
sir.
you. My second and final question to health officer is, you have indicated a former employee concerns that person is consulting with the National Labor Relations Board. Have you informed the Personnel Policy and Program Committee about this? Or I am a member there. I don't read all the email lately, so I may have missed.
So do you mean our internal Personnel Policy Committee?
That's what.
The,
No, you're talking, I think you're talking
The
about
committee.
the personnel. When was that? When did we receive notice of that complaint?
after, I believe, the
17.
Yeah, so, the PPA committee did not meet. We didn't have any discussion items at the time that that meeting was scheduled, so.
I don't know the details, but it will be good, if it is appropriate, confidential, inform the Personnel Policy and Program Committee. And,
If the board would be interested in a session to talk confidentially or during closed session, our attorney can write up, a document that will allow us to do that. We just need that direction from you, if that's what you would like.
Mr. Chairman, thank you. The reason all of us know, commissioners know, it's a liability to our board
Mhm.
and the organization. So it will be good for us to know instead of the last minute.
Oh, sure.
Thank you so much.
Absolutely.
Thank you, Mr. Chairman.
Yep, thank you. Any other questions? All right, very good. Let's move on to medical director's report.
Good morning.
Good morning.
My report in your packet, I think the two highlights for the month, well, today I'm meeting with a couple of latent TB patients right after this. So, I appreciate the staff kind of organizes all of that and gets all that together, and then things can come in and meet, with the translator. So we'll do that after the board meeting. And then, I was able to attend with Rebecca, Mass Fatalities Planning and Response for Rural Communities. on June 12th. It was an all-day meeting and it was phenomenal. Sometimes I dread those all-day meetings in all honesty, like we all do. But it was phenomenal. This gentleman had lots of experience, and discussed, true situations that happened in small communities, large communities, what they did, what they didn't do. And it was pretty amazing. It was a great meeting. So lots of ideas to kind of discuss at our level as well. And then my educational piece of, so I have to add, I appreciate last board meeting, I was out, my 88-year-old dad needed to have some surgery and he takes care of me home. So at the last minute, I was like, oh, who's gonna go do that? And that was me. So, so I try to look at the positive side, and I appreciate that I was able to spend some time with both of my parents. So they're doing okay. So that's a good thing. My brother and I were actually discussing how many years we went to the New Jersey Shore during the summer. So we would rent a home. My whole family lives there, so we would rent a house and we would all kind of meet at the Jersey Shore. And we were laughing at how expensive it was way back when, and it's even more expensive now. And how many summers we spent with 4 little kids not able to go in the ocean because there was red tide, or there were too many jellyfish, or there was seaweed everywhere. So we were kind of giggling that we would always look for a house that also had a pool. So why were we going to the beach? But that brought up these lake closures in the state of Michigan. So I'm sure a lot of people feel the same way when they book a home around a lake and then they can't enter the lake for some reason or another. So as of end of May, there were 7 lake closures in the state of Michigan, and I think it's still 7. It was at the beginning of the week. And you can see I listed them in the paper. And why are they closed? And more often than not, lakes in the state of Michigan are closed for polluted runoff. So water that most of the time drains after a big rainfall, or untreated sewage that's released into the lake. So the thought of that kind of makes you not want to swim in any lake. But and we've had those discussions about septic systems and being too close to the water and where they drain and how they drain. So so obviously those things expose swimmers to harmful microorganisms, and most of them at this point in the lakes in Michigan are E. coli related. So we monitor for those pathogens in several ways, but one, the state of Michigan is all voluntary to monitor those lakes. So they recommend that the local health department does some monitoring of the lakes, and there's some public health codes there to show us. And if you own a public bathing beach, you have to put a sign that says whether or not your lake has been tested, whether or not it is safe. So we don't have any signs on our lake. We don't have any signs which direction to drive your boat, which makes me crazy. We don't have any signs whether or not it's safe for swimming, but we have a big beach in Bobby's. So
What lake are you on?
Bobby's in Hillsdale County. Yeah.
Okay.
So,
Always counterclockwise.
so yeah, it's always it should be, but I wish more.
Airbnbs don't know that.
Yeah, I wish people who dumped their boats in the public launch would know that rule, but it's a little scary. And there is a very nice beach there, so there's lots of people in there swimming all the time. So the levels of E. coli, and it looks confusing, but there's several ways to kind of determine. But what I was looking at was kind of a daily max mean of 300 microorganisms per 100 milliliters of water. And you can do that. They have you test over 3 days or over 30 days, and there's all sorts of requirements when you test. So E. coli can cause lots of symptoms. We've all heard of those, mostly diarrhea. It can be severe. You can get bloody diarrhea. You can get urinary tract infections. It can infect your intestines. You can get blood poisoning. You can develop some respiratory trouble like pneumonia. You can even get meningitis, and it can actually go into your bloodstream and cause significant whole body response as well. So while most E. coli is kind of harmless, we don't get overexposed, so we don't have any symptoms. We have to remember that if we're swimming in water like that, you certainly can. So you can avoid it by not swimming after heavy rainfall, right? So if it rains, we would always do that. You're not going in the lake because it really, really rained, and I don't know. We have all septic systems around Bobby's, so we've talked a lot about hooking up, but it's quite expensive, as you know, so people don't want to go that route. So avoid swallowing the water, which is, you know, for adults one thing. For kids going under the water, I have no idea how much water my kids swallowed when they were little, but it was probably an awful lot. And you can shower and wash before going in the water to kind of not bring things on your body into the water. And make sure you wash your hands, obviously, after going to the restroom and before you get in the water. And you can avoid swimming if you've been sick and have had diarrhea. And you should look for signage on the waters and the beaches. And never swim, obviously, if it already says they're closed. And never swim in murky water when you can't quite see your toes, which is also kind of interesting in Michigan because, you know, Bobby is a little murky at the bottom if it's not used. When you go to the beach, it's beautiful, but if you head out into the lake in front of my house, it's pretty murky, so can't see your toes. And you would lose a flip flop if you tried to go in there. So yeah, I just wanted to put that in as kind of a warning and looking ahead when you're scheduling vacations and a good thing to tell all of our local people that when it's raining, stuff can go in. And we have a huge goose issue in the lakes too. I mean, it's really pretty bad at Bobby's when you drop your boat in and some of the docks are covered. And so all of that is obviously an issue as well. And I think that's all I really had today. We did meet all of the nursing supervisors about rabies, so we are prepared. We have a policy. We have a means for people who call to get information, to know what to do next, where to send the animal if they are able to capture an animal. So we are very prepared. Thank you.
Very good. Thank you for that report. Do we have any questions for our medical director? I have a quick question that kind of goes back to that. So when you hear about swimmer's itch, does that have what is that?
So not related, we think, to E. coli. There's all sorts of stories. So we were just talking about that with the pediatrician. So I had never heard of chiggers. I don't know if you hear of that, right? So
Yeah.
So we were just discussing that, the pediatrician in Hillsdale and I. So she's had a run on kids with chiggers, and some people will call that swimmer's itch. Some people will just get out of the water and feel itchy. But that is the goose feces contains some bacteria and parasites, and when you step in that or it's in the lake, and then these kids and adults as well will get like really itchy feet and red welts, and so that's another
From that.
issue that.
Interesting.
Yeah.
Very interesting. Okay. Thank you for the report. We appreciate that. Moving on to departmental reports. Environmental health. Mr. Paul.
Good morning.
Good morning.
The last meeting, I reported on the septic replacement loan program. And, earlier in the month, I did, radio interviews. One in Hillsdale, one in Coldwater, and one in Sturgis, promoting that program. And, we have already had some response to that, which I'm really excited for. We had, somebody in St. Joseph County that, we actually went on a complaint at a Bale sewage system. And our sanitarian kind of explained, and they were saying, I don't know how I'm gonna pay for this. Not that I don't want to fix it, I don't want to pay for it. Sanitarian explained the program, they signed up for the program, they got it, they got the loan. So that's really a good thing. And that's really what this whole thing is designed for. And so I'm really encouraged by that. We also got a call the day that I did the radio interview in Hillsdale. Maybe it was coincidental, maybe not. But, that afternoon after I did that interview, we had somebody call up inquiring about that, the program as well. So we do have that information on our website. And I think the radio interviews went very well, and I'm really encouraged that this program can really help a lot of people. There are low-income loans and then ones for anybody, but I think it's really important for those folks in this complaint situation. Knew they had a failed system, wanted to fix it, didn't have the money, and we were able to give them direction to get resources to get it done. So So that's really a success story there. So I'm really, really happy and encouraged about that. Last month, I reported that I was expecting to get some PFAS results from another round of testing at the West Side landfill. I still have not received those. Should be getting those soon. When I do, I will still
Thank you.
to you, Jared. I know you were concerned about that. And I'm not quite sure why it's taking so long, but as soon as we get those, we'll pass those along.
Okay.
Last month, I also reported that we did get some results back from some testing that was done around the Versicker plant Bandin. And originally, you know, the results all came back under health limits. And originally they weren't gonna recommend filter, but they rethought that. So one of the chemicals that they found is PFECHS, which is perfluoral ethyl cyclohexane sulfonate.
Yep.
That's a mouthful.
Yep.
But anyway, this is just one of the many PFAS chemicals. And this particular one does not have a health limit set on it. There's about 8 of them that have a health limit. But even though there's not a health limit on it, they don't know a whole lot about it. So they decided, let's go ahead and provide these people with some filters. I think is erring on the side of caution. I think that's very, very sound advice there. So I'm working with the plumber to go in and get those filters installed. There are 4 homes that need 4 or 5 that needed to have filters. So we will be getting those filters installed soon. So let's see, what else?
I had a question about there too.
Pardon me?
What is the city doing? I mean, you're talking right in the middle of that mess with where our wells are.
They test those wells all the time, and apparently there's no issue there with the wells. Those are monitored by the state. So, yeah.
But everywhere around it has it.
Well, I wouldn't say everywhere around there, but there was definitely some places that had.
I mean, from the map you showed us where you're going to put filters on, we're talking less than a quarter mile
Right.
to our well were.
And a lot of it depends on groundwater direction. You know, I'm not exactly remembering where the Mendon municipal wells are, but my guess would be that they're not downstream.
Are they deeper also?
Most likely. I don't have a lot of information about the municipal wells. We don't monitor those. A couple other things I wanted to talk about. In White Pigeon, the village has got some grant money to expand their municipal water system into the township to the area where we have the PFAS contamination. The number of houses there that are unfiltered, that we've been supplying replacement filters. Obviously, we would like to have a permanent solution there. They have got grant money to expand that municipal water system. What they have to have buy-in from the people. So they have to have at least 50% of the people say, yeah, we want this. And so they are doing a community event on July 10th from 6 to 10 at the Township Hall. And so there'll be members from Eagle, from MDHHS, from the village. And we're just trying to encourage people to sign up for this and get that permanent solution. There are some people in there that don't have contamination in their well. Well, why would I want to pay that hookup? And even people that have the contamination is like, I've never had a water bill. I don't have a water bill. So there's some issues there, but we're gonna have a public meeting and have a lot of information out for folks to just kind of let them know how important it is that we get the permanent solution for those folks that are within that area of contamination.
But you said we are not a part of that though, right, Paul? Are you gonna be a part of that?
I will be at the meeting, yes, yes.
And you'll be presenting that also?
No, I'm not presenting, but I'm gonna be there representing
Board of Health?
the agency,
Okay.
yes, absolutely. Yeah, presentations will be done by Eagle and MDHS, yeah. Let's see, July 11th, am going to be doing, a presentation to the Little Long Lake, Homeowners Association. They have asked, when we come out and do a presentation on, care and maintenance of septic systems. So they have some concerns about, pollution getting into the lake, and, they've asked me to come out and do a presentation. I actually, was scheduled to do it earlier, and we changed the date to this one in July. They're actually gonna, that's their annual meeting for the homeowners association. I figure they'd have the best out showing there for folks. So obviously the more people that can be there, the better. So that's on a Saturday in the morning. So I will be out there and doing a presentation for those folks.
Where is that at? Where are you doing that at, Paul?
It's at the Methodist Church in Waldron, I believe. Camden.
Gonna say,
Don't
you're
go
going a
long.
long way
Yeah,
here.
no.
You're going a long way.
Yeah.
You're going a long way.
Sorry. Thank you, Chris. Camden. Okay, Becky reported that, James Young, our newest supervisor, who was promoted in January, has turned in his resignation. That's a difficult position to fill. And I think it's worth noting, talking to James, one of the reasons, that he decided to look elsewhere was because, you know, when he was promoted, he got a 2 cent an hour raise. Brought that to the board, and, you know, it was against policy, but, that was a big factor in him moving on. It really kind of was insulting to him.
Well, he knew that before he took the job, right?
Well, it was more than a 2 cent per hour,
No, it wasn't.
because he also got the inflation after that. So it was more than a 2 cent per hour raise.
Well, regardless, I'm just passing along the information that he shared with me. That was one of the factors and for the reason we lost him.
Which James will.
So, he's moving on to OSHA. I think he'll do very well there. He's a really smart guy, and he's gonna leave a big hole in our department. So, I think that's all I have today. I'll be happy to answer any questions.
Thank you for that report. Any questions?
Well, and I don't want to put you on the spot, Paul, regarding the public comment that we had this morning. And I don't, what type of license was that agency looking for then, or did they get?
It's a temporary food license.
So temporary food license, and we have on our fee list a nonprofit temporary food license. Okay, 501c, doesn't matter what the number is after, it's nonprofit.
Right, it's just a
501.
No, 501c,
Well, I'd have to look at it, Brett.
and again, I'm looking, now, looking at our fee schedule online, we have underneath special transitory food unit, we have STFU 501c3. That's the only one that we designate the 501c3 on.
And then it's a typo on the fee sheet because they're all supposed to be 501(c).
Okay, then
That's what the food law says.
So I just sent you all an email with a link to the food law where it references this 501c3. I do think it's possible. I am a volunteer in another organization and just recently read through the letter that they received from the federal government that identifies them as a nonprofit. And the letter reads at the top that they fall underneath the category of a 501c3, but their designation is different. It's not actually 501c3. So I think it's possible that we've misinterpreted what a 501c3 is. So, you know, and this, I didn't know anything about that myself until just recently reading through the letter from this other organization that I volunteer for. So in the letter, it talks about this umbrella 501c3 and then specifically identifies their particular designation, which is a different 501 type of lettering. It's still 501 something. So I think I need to seek out some additional clarification on what that means in the food law with regards to that 501c3 designation, because if you look at the section, the MCL section, it says a charitable, religious, fraternal, service, civic, or other nonprofit organization that has tax exempt status under section 501c3 of the Internal Revenue Code 26 USC 501.
501c ten, just a subcode underneath that, because
I think so.
there's an 8, which is fraternal, there's a 10, which is
Yeah.
Masonic, and there, I mean, every one of them under there is just a subcategory for a
Right.
different organization.
And I didn't understand it that way either until, I mean, this is just in the last month. I applied for a grant for this organization that I volunteer for and was able to get a copy of this designation letter. Prior to that, you know, I was uneducated, I guess. I just made assumptions based on what this says. But having read through that letter recently, I think we've been misinterpreting it. So again, I need to do some additional research.
And I certainly don't have an issue refunding him the difference there. You know, we're just, our staff isn't trying to go by
Yeah.
the letter
Be
of
consistent.
law. And, you know, so
Yeah.
that's where that lies. It certainly is not intending to help.
Yeah, no.
And I'm sorry you took off before we had the chance. to
Yeah,
discuss it.
yeah.
We'll get back.
I'll get back with him.
As a board member too, I would highly encourage us to look a little bit deeper into that and just see if we can figure that out. Because obviously, I mean, just practically speaking, they're trying to do something that is beneficial to the community.
Sure.
So let's work with them, obviously, right?
We don't wanna squash them and
Yeah.
make them pay more,
Yeah.
but, you know, we're also bound to follow the rules and the way it's written. So
Okay. If you-
That's where we're at on
If
that.
you guys could look into that and kind of report back to us then at our next meeting,
Absolutely.
that would be thank you for that.
Mhm.
Any other questions for Paul?
I just wonder if you can pronounce it.
I know, right?
You know, I practiced all morning and I still screwed up.
Hey, we give you an A for effort. I would not have attempted it.
I wasn't going to, I was just gonna go with the acronym.
So practice is
Let you go on that. That easy, dude.
Practice went well.
The PFAS testing at different sites, do you have the different results from the different sites around that area? From the state?
Yes.
So you can tell me each site what the PFAS rating is?
We only had actually, one site that was in the township that had PFAS, and they're already on a filter. When the original investigation started, there were some homes within the village of Mendon that still had wells, and we did testing on those. And there were some hits on the well from the municipal system, but all those have hooked up to the municipal system.
So we don't have the results from where they did boring.
I don't have results where they did borings. No, that you'd have to contact Eagle.
So like in the village, if someone wanted to put a well in, they could not do that, right?
No. If they're on municipal water, they're not, and especially if there's a known area of contamination, we're not going to
Even
issue.
if there's not, I mean, is that a state law or what is that? If they're on municipal water?
If they're on municipal water, well, anytime that there's a known area of contamination, as a health department, we can say, you're not going to drill there, because you're just potentially spreading that contamination further.
I'm just saying if there's not a known area.
If there's not a known area, then some of the municipalities have actual codes in there that
So the
say-
local code.
because then there's the potential of cross connections. So if somebody drills a well and then you have a cross connection, and then they have municipal water, you could have a cross connection, and they don't want that. And most of the municipalities say, no, you're not. If you're on our system, you use our system, because there's the potential of cross connections. And
I was just wondering with all the problems we're having, and we keep hearing like the different waterways that get through Riverside City and stuff. If it was possible for these people to drill wells.
The river, it's not. You know,
It's-
city commissioner.
It's also in the environmental health code. The environmental health code would restrict the opportunity to install
If you have municipal,
if you have municipal fields. We are not allowed to issue a permit. So could you install an irrigation well? Perhaps, if the city let you. But we would not issue a permit. We don't issue permits for irrigation wells. Period. We do not issue them.
Now,
There is a, yeah.
I'm even thinking, would the city have an authority on an irrigation well because of right to farm issue? Probably not.
Probably not.
They might, if it's a well protection area, they might be able to do some restrictions.
City's tries,
but-
Brewery Ridge tries to.
Well,
I don't know
you
if it's
would-
ever ran into
They
that.
would still have to comply with the, groundwater withdrawal.
Withdrawal, yeah.
uh,
From DEQ or Eagle.
Yeah.
Right.
But I'm thinking
For
more
your
like,
water.
yeah, I'm thinking more like somebody wants to put down a stab well to water their garden,
Yeah.
right? Like, I don't wanna pay the city water bill to water my garden, so I'm gonna put down a stab well and just hook it up to a pump and that happens. And it probably happens all the time and nobody knows.
But you don't have to worry about cross contamination if you do that.
Right.
Because it's not hooked up.
Well,
If it depends on how it's hooked up.
Yeah.
If-
It was literally just hooked up to the pump to
If it is,
irrigation.
if that's all it's hooked up, then there's no potential for cross contamination. But if you put down a stab well and it's not grouted, it's not tested, and that just raises a lot.
And, and some of the concerns, even in the agricultural community on PFAs, is where there's been some of the sludge or other things, surface supplied,
Yeah.
or even subsurface supplied to agricultural ground, that the plants that have grown off of that have taken up that PFA material. It's actually been found in some cattle. So, if you're irrigating, if you're watering your garden with a water from a well that has PFA contaminants in it, are you now
Consuming that.
you're spreading it.
introducing that PFA material to that plant that's going to take that up out of and transport that into the fruit or vegetable that you're eating.
Right. Very good. Any other questions? All right, moving on. Miss Laura, Area Agency on Aging. How are you?
Good morning. I'm well, thanks. Hope everybody else is well
As well.
as can be
Sorry about
this very
Wow.
sort of dry morning. I felt human again, literally after getting into my car. So it's been a quite the busy month. I've attached and enclosed the response letter from our May 8th assessment with our aging representative, Ashley. There were no findings or recommendations. The budget amendments for providers are before you later in the meeting today. We do have, as Rebecca reported, 2 openings, and interviews set for next week. So I'm going to be keeping toes and fingers crossed that we find a good candidate for each of those positions. When you're a small organization, we only have 5 staff, so when 2 are gone, you can do that percentage in your head. Becomes real difficult. Hard to keep up. The Services to Victims of Elder Abuse program continues to work on some policy reviews. There are just wording changes, as I've indicated in the past. Hopeful to get those done. I'm going to be talking with Teresa likely next week about process and if we can get these done or not, or what our process is going to be. At least get some draft language to them at a bare minimum. That's really all that they're looking for. So we're working on, based on a Branch County, actually the Sheriff's Office requested training from our victim specialists. So we're working on a PowerPoint for local law enforcement and can share those highlights with you once those are finalized. But it's kind of exciting to be requested for training for your officers. So that's great. The Legal Services of South Central Michigan organization is going to assist us in revising and enhancing our protocol in St. Joseph County. And so that will continue into next fiscal year as well. It's going to be a part of our narrative in our grant application that we're developing now. The eGrams application is open, so we'll be putting those focus points into next year's application. our plan, for the area agency on aging, the implementation plan was presented thanks to Commissioner Matthew at the working meeting last week. And, there were quite a few, kind comments and gratitude. So that'll be placed on file, as I was told by, Administrator Norman after the meeting. So that's always feels good to have the presentation and have it be received well. So we'll be in St. Joseph County on July 16th. And just gave an update number 3 there, sort of where we are with all the assessments. We're being assessed a lot in the last couple of months. So we have 2 more provider assessments to go. I'm partially done with Thurston Woods, Thurston Cares Adult Day Program, but and then one beyond that. So we just keep plugging along, and the Board of Health will receive a summary of those assessments and any findings or recommendations that are issued. The June 21st, last Friday, was a big day for the Three Rivers community in St. Joseph County. Commissioner Hoffmaster was able to join us, so thank you again for taking time out of your morning to come over. The Michigan Commission on Services to the Aging came down to scenic St. Joe County to hold their business meeting, their regular meetings, and then following lunch, they hosted a public hearing to which there were around 6 people who testified. We were able to give a welcome and greet them, and Commissioner Hoffmaster gave some very nice remarks. So thank you again. Rebecca and I were also at the podium, and their Commission on Aging director gave a tour of the residents in the senior center there, and spoke of the collaboration and all of the direct services provided. So it was a really neat opportunity to meet those delegates that literally the Upper Peninsula commissioner was there. So that was kind of fun to see an old friend that I've not seen in many, many years. But he, it's a great diverse board. They very much pay attention. This is the group that approves our annual implementation plan and authorizes our contract. So we definitely want to keep those folks close, and I think we gave them a great tour and great time, great day. So I don't think I have anything else additional for you today, unless there are questions you might have.
Thank you for that report. Any questions for Laura? I will say that Rebecca and Laura did a great job representing the Board of Health, and they did really good speaking at that. We so in Three Rivers, Broadway was literally being repaved as this really neat meeting was taking place from all, people coming in from all over the state, and they get to experience the orange cones of Three Rivers, which is really unfortunate, but they made it. They made it, and it went well. So.
One-way traffic
Yeah.
on a 2-lane road.
It gave them an opportunity to see Three Rivers as they went through the detour and right into the COA. So we do appreciate that. That was really a neat meeting, and that was good. So awesome. Well, thank you for that report. Moving on to our personal health and disease prevention. Ms. Heidi. Good morning.
As Becky said earlier, Michigan is slow in the spread of HPAI, but the upcoming fair season is kind of causing some concern. The fair season health advisory came out yesterday, included a healthcare provider alert that we did forward on to our local providers. This had some key points, including exposure risks for swine and HPAI, and we're kind of maintaining a low threshold for suspicion. This test whenever it's have any thought that they could be affected. We also received late yesterday the notice from MDAR that they amended their emergency response to include guidelines for fairs and exhibits. Some of that includes any cattle not lactating nor in the final 2 months of pregnancy must be tested in the last 7 days. And they can either do a nasal swab or a milk bulk tank sample from the dairy farm. Fairs must also have signage educating the public about biosecurity at the entry and exit of every barn. And they also give some guidance as far as having visitors stay 6 feet away from the animals, and then some recommendations on maybe limiting the time the animals are at the fair. So that just came up. 7 mosquito pools have been tested positive for Canyon virus, which is spread to people by mosquitoes. Sometimes their symptoms include fever, fatigue, and headache. And also, Barry Eaton County has been investigating 3 cases of Legionnaire disease from Bay Point Inn in Shelbyville between March and June. Legionnaire is the type of pneumonia that people get by breathing in mist that contains that bacteria. Symptoms include cough, fever, headache, muscle aches, and shortness of breath. We did have one Branch County member that was at the Bay Point Inn during that time, was diagnosed with something different, but we are having him tested just to see if it could be Legionnaire. So he did receive some antibiotics, so the test might not be accurate. We did go ahead and reserve our Pfizer vaccine for the fall for the new formula. And Samantha, our immunization coordinator, she attended the vaccine championship meeting in Lansing on June 5th. She really enjoyed the meeting, came with a lot of good ideas. Vaccine champion is just somebody who is passionate, highly educated in vaccinations, and we're going to have a champion at each location. MDHHS is also working on a map of BFC providers and vaccination deserts in each area, so we can kind of target them, help increase our numbers. Mobile unit Amanda, she's been very busy. She's also been doing outreach for local farm workers. She's been attending the jails, Brant and the Hillsdale as well, and she's with 13 vaccines in Hillsdale jail. She still goes to Waldron monthly. The last time she was there, the librarian said that another library called and asked about our services. So hopefully they'll give us some business too. Talk about our staffing update. Rick, we still have not started Produce Connection. We're still kind of waiting for the green light on that. They're still working out the benefit EBT card issue. Children's Special Healthcare. The team has been working with their family centers to provide training and support for bereavement to families who have lost a child. And Harry has also been, our nurse in Children's Special Healthcare has been brainstorming ideas to bring more education to the Amish communities. Like a driver and a friend had also mentioned that they don't do any education on the human body, and asked about getting some diagrams and kind of amp that up. So I think she reached out to Health Ed about that too.
Very good. Very busy, I see.
Yeah.
It's good. Thank you for that report. Any questions, Friday?
Thank you, Mr. Chairman. Could you address Miss Heidi? Miss Hazel, thank you. Director Hazel. Cannot see from here, sorry. Could you address, Mr. Chairman, have Miss Hazel address that paragraph 506 about COVID, there is a term playing with now?
Oh, yeah.
Which one?
The booster shots, they're not really calling it booster shots anymore. Just updated shots, just kind of get away from that lingo.
Why is that?
To be honest, I don't know. I think it's gonna be like the flu. They get a
The
shot every
next
year.
strain.
Yep. Any other questions? All right. Very good. Moving on. Health education promotion. Chris.
Good morning.
Good morning.
So you have our report in your packet. Just a couple of things to add. Since this was written, we have increased distribution of our Lock It Up bags to 650 that have been distributed across the jurisdiction. Josh did do live interviews on the radio stations, Coldwater, Hillsdale, and Spurgis. And the WILX from Lansing was down and did a feature story, which turned out very well. If you go to WILX, you'll probably pick it up if you'd like to watch it. It was a rather lengthy interview, more lengthy than we normally get. So we have our videos on our YouTube channel, and as of earlier this week, we had 485 views. The most viewed video is our marijuana and the young brain. and 31 individuals have taken our quizzes that are attached to those videos. Today is National HIV Testing Day, and so there's some information about that. Just for your information, the agency does offer confidential curbside if required testing for HIV. Individuals can book those appointments online, and if an individual would like counseling or consultation around HIV or concerns about HIV, they can call and make an appointment at the local office. We issued 2 press releases since the last Board of Health. One was our Lock It Up campaign launch, and the other was heat-related illnesses and safety, including cooling centers that we issued during our little heat wave streak there previous couple weeks. Just as a side note, I received an email this morning that we've had our 4th pediatric death in the nation from being locked in a hot car. So just as a reminder to parents, especially when we start reaching these days of high 80s, 90s, it is important for you to look before you lock to ensure that you have not left any children or pets in your vehicle. Our community health worker program, pleased to announce that our 2 community health workers have started their roles. They are in their community health worker training through the Michigan Community Health Worker Association. Lisa Redmond has been working with the Area Agency on Aging as an outreach coordinator and a MAP counselor. And Alexander Ali Salim is joining us from Oak Lawn Psychiatric Facility as a case navigator for patients from that facility. So he has some very specialized training that I feel will be very beneficial for our community. They will finish their certification course on August 1st, but currently the state does allow for a work experience pathway to certification, and both of these individuals qualify. And so we have submitted their applications for certification now. So hopefully we will hear in the next 60 days. They've also applied for their national provider identification number, which is a step towards ensuring that we can provide services and receive reimbursement. And both of them have received those NPI numbers. So we are moving forward, full steam ahead. You can see the events that we have. I've been asked to do a presentation in Hillsdale County to the Department of Human Services case managers regarding the programs and eligibility for programs the health department offers. I am more than happy to do that for Branch and St. Joseph County if requested. On July 11th, I've been chairing a committee for Branch County 211, a collaborative committee, including multiple members who are part of the Great Start Collaborative and the Branch County Community Network. So we'll be at the July 11th Commissioner Work Group meeting to talk about 211 implementation for Branch County. And I do believe those are all of my highlights.
Very good. Thank you for that, Chris. Any questions? Okay, very good. Thank you for that report. We appreciate it. Moving on to 6, financial reports. Ms. Teresa.
Good morning.
Good morning.
Just looking out at the bills, a couple things I wanted to point out to you. On page 71, you'll see one for Century MERS, $350,631. That includes the $302,495 that we sent to the surplus fund that's voted on by the board. So that payment has now been made. And then if you look on page 73 at the bottom, Willowbrook Interiors, that would be the carpet for Hillsdale. So that project is wrapped up and the carpet looks great. So I wanted to point those out to you. Any questions, I would be happy to.
Any questions?
Move to approve the payment of bills as presented.
We have a motion.
Second.
We have a motion and support. Further discussion? Seeing none, all in favor with an aye? Aye. Opposed, the same. Motion carries. Financial.
So, at your place, you have a revenues and expense sheet. I did finally get that caught up. I've been a little bit behind, but it is at your place. It was not in the packet. So that is now current. You have the balance sheet on page 74. And on page 75, this report looks a little bit different. I was trying to make it easier for you. I'm not sure if I succeeded or not. So I'd like a little feedback. We used to print this report and then on a separate page, give the explanation for things that were over. And I thought, well, wouldn't it be great if we could put them all together on one page so you could actually see and not have to flip back and forth? But it does make the page very busy.
Yeah.
So you'll have to give me direction on if you prefer this way or if you would like me to go back to the old way. There are a few programs that are actually have a little bit of red there, you see. 371, that grant ends on 6/30, so it is done. There won't be any more expenses, which is why you see it at 98.34% expended. RU10 is the administration and indirect. That is showing over because there's a lot more revenue in there than what we anticipated, so the expenses have to stay in that grant and not change. So that's a extra revenue problem, not an extra expense problem. And then RU24, that's the MERS pension underfunded liability. We made that large payment of the $302,000, which is why you see that mostly expended because that was the major part of that. And then moving down into lead testing, body art, and Medicaid outreach. Those three are over and will be addressed in our budget amendment. I would be happy to answer any questions you have and welcome your feedback on whether or not you like this better.
Thank you for that. Any questions?
Just a
Yes.
minor question, small amount. What's that body art? I don't see everything.
So Body Art is the program that we use to track our inspection of tattoo parlors and places that do body piercings. So Body Art. Paul can tell you more about what that really means than I can.
Paul's got some tat. Is that what you're saying?
I do.
Piercing.
No, piercings. Any other questions? All right.
Move to approve the month-end financial.
We have a motion. Or we have support for the discussion.
Teresa.
Well, there you go. There's your feedback.
Yeah.
I'm not so sure yet.
If I put it together, I was like, this is going to be great. I put it together. I'm like, oh, that's really busy. I'm not sure. And so I decided to go ahead and give it to you. Let you guys tell me what you want.
Maybe you change the font size of your description below it or something. So break it up a little bit more.
Bold the numbers. It does a
Can't we
little.
just do it in blue?
No.
How about green?
No. Very good. All right. We have motion and support. All in favor with an aye. Aye opposed the same. Motion carries. Committee reports. Finance Committee. That is me apparently. So yes, we did go over the budgets. It was a good meeting. You see the meeting minutes as of June 17th before you on page 78. We'll discuss further in new business.
Move to approve the finance committee minutes as presented.
We have support. We have support. Further discussion? Seeing none, all in favor with an aye. Aye. Opposed the same. Motion carries. D, program policy and appeals.
We did not meet. No meeting.
Did not meet. Slackers. Okay. Moving on. New business. A, AAA provider budget amendment on page 79.
So this is the document that you reviewed in the finance committee and you moved it forward for approval.
What do we got going on here?
You got a lot going on.
In essence, we're awarding, is it budget amendment or awarding the final allocation that we finally received from the Fed and state agencies.
These incorporate the most recent full year statement of grant award. So it incorporates changes that I've discussed with providers, discussed among our leadership, and incorporate the federal and state laws that are in place for these different funding sources. And also incorporates major reduction in the one nutrition funding source for this year. I'm not sure how that's going to look and what the Bureau will be projecting for next year. it's unknown at this time. I mean, we put together our annual implementation plan budget. But with the trends that we're seeing in this year's award, we're cautiously, moving forward with next year. But for now, overall, there won't be, with the exception of the one respite funding source to the adult day program, there are no overall cuts to providers in the amended sources. So we were able to mitigate it this year, but
Through ARPA funding,
through
through the
Yeah.
use of ARPA.
and we just found out last Friday that they're allowing carry forward into 25 for ARPA, which previous guidance up until that day, that was the first day I had heard of that. It was done September 30th, but now if we can carry forward, we may be able to make some adjustments to help for next year, but
Did we have to do anything with the budget on what, Al Binlock came in with the other day? On the transportation end?
no, we'll take that into consideration as we approach the provider awards that will be before you in August, we're hoping. And so you'll see a major sort of reduction in one particular program, but you'll
Right.
see the increase, the same amount into,
no
hopefully the
draw.
same amount
Yeah.
into the medical escort grant. So,
Good question.
yeah, good question.
All right, any further discussion? I don't think we have a motion or support yet, do we?
Make a motion to, approve the AAA provider budget.
Very good. We have a motion.
I support Mr. Chair.
We have support. Further discussion? Seeing none, all in favor with an eye? Opposed, the same. Motion carries. Moving forward, B.
Yeah, so we're not gonna be looking at the packet, page 81 through 112. We'll be looking at the yellow supplemental packet. There is a slight difference to this budget from the budget that the finance committee reviewed. And that is because I realized that the budget that the finance committee reviewed did not include the measles grant that came to us in May. So I needed to put that in there and I had accidentally left it out. So I have gone through and added that. And if you look at the yellow or the orange sticker, that column that orange sticker is on is what was added to the budget. Everything else is. Well, if your orange sticker fell off, it would be
Or if you're colorblind.
on
Page 10.
on
Yeah,
page 10 of 11, the column that's titled measles, that column was added. And
Way at the back. It's way.
I'd like to make a budget amendment, get better, sticky,
Yeah.
arrows here.
well, I bought those actually while I was on vacation and you posted mine in Mexico, so that might be
Wow.
That would be wise.
Yeah.
a little something.
You didn't realize they were looking at Stickum.
Yeah. So this budget is $25,000 more in both revenue and expenses than the one that the finance committee
Because of
approved
the.
because of this measles funding that was not included. So now I want to bring your eye to the pink sticker.
What page is that? That was a lot.
That one doesn't have a page number, so it would be the
Supplemental.
The last landscape page.
This,
Well, second to last. No,
local dollars.
Third.
to agency.
third to last.
City consolation, mine is here.
Your pink sticker is missing.
so it's the back of the first white page.
Right there.
The back of the first white page. So down here in this area, this shows you what we've actually allocated for use. So the budget, if you can see in column 1 there, the budget's $13 million budget, but we're only actually allocating for use the 9.5 million. And the reason is that we are including now the fund balance. So that's kind of the snapshot of where you're going to see what the total dollar amount that is allocated for use is, now that we are in compliance with the law and are including the balance. And the other piece that you guys generally like to look at is the grade sticker, and that's on the very last page. And that breaks it down easily and tells you the total of each type of funding that we get.
Yes, sir.
I make a motion to budget amendment to the green orange and pink.
Yes, thank you. It's a good motion. Do we have support? I'll support. We have a motion and support. Further discussion? I will say the finance committee did review this with Teresa and Rebecca. I appreciate you updating this with the measles grant there. All in favor with an eye?
Aye.
Opposed, the same? Motion carries.
Well, Teresa, thank you for the email you sent me on the other.
You're very welcome.
Very good. Moving on to C. We have the 2025 original budget.
Yeah, so on page 97, there is a typo there that should say original budget, not amendment number 2.
Yeah.
So now, you can tell the difference because this one has got the column highlighted in pink. So then I didn't get confused. This budget is your original budget for FY25. There are still so many unknowns that this budget is largely unrealistic. It does not have all of the inputs to make a realistic budget, but I'm required to have a budget to the state. So we have put together a budget. We will definitely be amending this budget and probably a little bit earlier than what we normally do. We normally shoot for a budget amendment in January. We'll be shooting for an earlier budget amendment this time. I am not as good at forecasting simply because I don't have as much experience at budget forecasting as Brene did. She got really good at it. It takes me a lot longer time to do than it did her. So I didn't have a really, I don't feel like I've done a great job of forecasting because I didn't have enough time to put it together to meet the state debt. So we have budget that we're going to give the state, and then we will be working on our budget amendment. Actually, we'll be starting on that budget amendment next week when the new payment starts, and we probably won't be bringing it to you until probably November, but we'll be working on it, and we might have it, but we'll be working on a budget amendment once we get more inputs and know what we can expect with revenue assessments and expense changes.
Very good. Can I get a motion?
Make a motion to approve the fiscal year 2025 original budget.
Very good. Support. We have a motion and support. Further discussion?
Yeah, just a couple of comments. Number one, I like the fact that there's no budgeted request for increase from local county appropriations in this budget. Appreciate that. And Teresa and Becky and I talked Tuesday, and she just said this budget was kind of a stab in the dark at times. Even after this budget was looked at by the finance committee, we got the report from MERS that shows our contribution going up, what, $80,000? That, you know, our planned contribution, or said to go up 80,000. That's not included in this budget, so.
Right.
So, yeah.
It's a work in progress.
Yeah.
Yep, very good. Further discussion? Seeing none, we have a motion on the floor. All in favor with an aye? Aye. Opposed, the same. Motion carries. Item D, which Commissioner Leininger put on here for July board meeting, essentially rescheduling. Or canceling, sorry, yes, canceling. It feels like we might not have a quorum. So we, Rebecca, Teresa, we have some very important absentees, which is absolutely fine. But we're hoping to reschedule, or not reschedule, to cancel July's meeting, I guess, in the end. And we're looking for board.
Yep, and we did
Input.
look forward to see, you know, what might be something that we would be addressing in July. And at this time, there isn't anything that requires action, so.
Okay.
Welcome to cancel the July board meeting.
Support. Okay, so we have a motion and support. I would also say that
And that would
also
be committee meeting.
includes the committee.
Board meetings.
Yeah, committee and regular schedule.
Yep.
For July.
Yeah, finance and.
Yep. All right, we have a motion and support. Further discussion? Seeing none, all in favor with an aye? Aye. Opposed, the same. Motion carries. I am going to be in Indiana. That's good. So we have that. Okay, moving on. Public comments. We lost our public commenter, but we will open the floor to public comments. We appreciate that. Don, you don't have anything for us? All right.
Going on.
All right. Okay. Item D, or I'm sorry, 10.
Mr. Chairman,
Commissioner Matthews.
it is my pleasure to make a motion to adjourn of June 27, 2024 meeting.
I can support that.
We have motion and support. All in favor with an eye? Opposed the same? Motion carried. All right. Thank you all for being here.